And listen, you've seen them at the end of strip shopping centers, inside malls, in the back of grocery stores. They are retail medical clinics. The doctor in our house, Dr. Alicia Arbaje, is here, and she joins. Now, you're not condemning them, but you're saying, don't, do some more work. Go to your own doctor, right?
Right. The bottom line is the best thing to do is to go to your own doctor, and if you don't have one, to find one. These clinics are there for sort of if you can't find any other way, but really the best thing to do is to go to someone who really knows you.
Well, like, somebody goes in every day and gets their blood pressure taken.
Right. Right. So again, if you're going somewhere else besides the doctors, your normal doctor or primary care provider, then you got to write down what you did, what you found out. If you stick your arm in the blood pressure cuff, write down that blood pressure and get it back to your normal doctor so that they know what happened.
All right. Give information. Tell them a little bit about yourself.
Right. So if you end up having to go to one of these retail medical clinics in a grocery store or drugstore, they don't know you. So you got to give information and you have to get information. Tell them about yourself in detail because they don't know who you are. Your medical conditions, your medicines, why you take them, all those types of things.
And of course, go to the ER if your symptoms are really bad.
Right. So if you do need to go to one of these places, before you decide if you need to go, if the symptom is new, if it's serious, the retail medical clinic is not the place to go. They're not equipped to deal with the kind of emergencies and complications. So we can talk about some of the symptoms.
We're going to talk, but what we're trying to give you is a scenario here. If you're in the mall, it's hot out, 100 degrees.
Exactly.
We're in the mall, and all of a sudden, you see a little clinic, or I'll go over here and...
Right, exactly. And remember, older people have special needs. They have many medical conditions. They have lots of medicines that they're taking. These clinics aren't set up to deal with that kind of complexity.
All right, let's role play. Ready?
Okay, I'm ready.
All right, I'm having chest pains, shortness of breath. Where do I go?
You got to go to the ER for that.
No kidding. All right. Numbness, weakness in my arms. I have trouble speaking.
Yeah, sudden onset of anything, including numbness, weakness, and not being able to talk, pretty much go to the emergency room for that.
I got a cough I can't get rid of.
If you've had this cough for a while, you've been dealing with it, that's something you should bring up to your regular doctor.
All right. Memory problems. Can't remember. I'm starting not to, I'm losing it.
Again, anything where you're starting to have symptoms that have been going on for weeks or months, that's not something you bring up to a retail medical clinic. You bring that up to your normal provider.
Refills for my medication.
Definitely your provider. You don't want to go to a retail medical clinic for that.
All right. We just talked about the blood pressure check.
Right.
Cough and cold symptoms.
So there it's okay to consider going to one of these clinics. Something that's kind of acute. You have some allergies, symptoms that you're trying to deal with. Maybe you ate something that didn't sit right with you. Or maybe you're not near your doctor and you have some kind of minor symptoms. Then it's okay. But the thing is, these things are called minute clinics. It doesn't mean you go in and out in a minute. It means you go in and you get a report of what happened to you, and you don't stick that report in your purse and take it home. You take it to your doctor or your primary care provider and let them know what happened when you were there.
And my stomach is upset. Where do I go?
So again, if it's just kind of you think it's something you ate or maybe it's some indigestion, it's okay to go for sort of a quick treatment to one of those types of clinics. But again, most of the time you should be going to your normal provider for these types of things.
I'll put you on the spot.
Okay.
Your mother's in here all the time, visiting here.
Yes.
Does she call you for medical advice, or does she say, you know what Gladys said? Gladys said I ought to go to see...
Yeah.
Does she?
Absolutely. Well, I have this happen with family a lot, you know, the doctor and the family, so they'll call for these types of things. And that's kind of the same way that people use these clinics. Oh, let me get a second opinion, or let me, this clinic is just right here. Let me see if I can just get another idea of what's going on. And again, that's not the real reason. The reason people don't go to their normal providers is because they can't get an appointment or they think it's too much hassle. But really, you want to have a long-term relationship with someone. And I tell that to my own family. It's okay to ask me for some quick things here and there. You can view me as kind of a retail medical clinic,
good.
But in general, you want to go to someone who really knows you well, and that's the person who takes care of you on a regular basis.
I know Megan will agree. I think every family should have a nurse or a doctor in it. I think that should be mandated because, man, you'd be lost without.
Well, so that's an important point because they help you navigate through that complicated healthcare system. So you want to make sure that your doctor or primary care provider is someone that can help you navigate through your healthcare system. That's what geriatricians do, and if an older person doesn't have a geriatrician and is feeling overwhelmed with all that navigation, doesn't have someone in their family like that to advocate for them, perfect person for a geriatrician.
Doctor, thank you so much. Your mother's on the phone now.
Oh my God.
Okay, Megan.